everyone. My name is Daniel Ampoma. Together with Kwame BOAKYE-DANQUAH and Irene Horsham, we will moderate today's forum. GAG Global Forum is thrilled to be presenting on the topic, the elections are taking place in a democratic atmosphere. As the world wrestles with the novel coronavirus pandemic, what are some challenges for Ghana? The panel is one in a series of forums that GAG Global Forum has in partnership with Beyond the Return, put in place to deliberate on issues of global and national importance. To help us with our deliberations today, we are honored to have in our midst distinguished personalities, and I want to take this opportunity to introduce them. We have Honorable OWUSU-EKUFUL. She is a lawyer, a women's rights activist, and a Ghanaian parliamentarian. She is also the Minister of Communications for the Republic of Ghana. Welcome, Honorable. Next, we have Dr. Anthony NSIAH-ASARE. Dr. NSIAH-ASARE is the Presidential Advisor on Health. He is also a member of the Presidential Task Force on COVID-19. Welcome, Dr. NSIAH-ASARE. Next, we have Honorable Kojo Yankah. Mr. Kojo Yankah is a founder of African University College of Communications, AUCC, Accra, Ghana. He's a former member of parliament and a minister of state. He's also the former chairman of Panafest. He's the author of 10 books, including From Jonestown to Jamestown. Welcome, Honorable Kojo Yankah. Next, we have Dr. Collins A. Kwarteng, MD, FACC. Dr. Kwarteng is a private, general, and interventional radiologist, cardiologist. He's the owner of the City of Hope Heart and Vascular Center, LLC in Dublin, Georgia, United States. He also has a practice in Las Vegas, Nevada, and Beverly Hills in California. Welcome, Dr. Kwarteng. Next, we also have Professor Eric SAMPANE-DONKOR. He's the head department of medical microbiology at the University of Ghana here, Legon in Ghana. He's also an academic editor of the Pathogens Journal, which is based in Basel, Switzerland, and also of the Journal of Ghana Scientific World Association. Dr. Professor Eric SAMPANE-DONKOR, I want to welcome you to our forum for today. We also have Ms. Awo Chumesi. She is an entrepreneur in Ghana. Ms. Awo Chumesi, welcome to our global forum for today. And we also have in our midst, as part of our audience, to discuss on issues of this magnitude and importance, Dr. Alex Dodu, Dr. Alexander Dodu. Dr. Alexander Dodu is the Director General of the Ghana Standards Authority. He's also the Director General of the Ghana Standards Authority. And then also he's an Associate Professor at the Center for Tropical Clinical and Pharmacology, School of Medicine and Dentistry, University of Ghana. I want to say welcome to our distinguished personalities. We really appreciate the time that you've taken off your busy schedule to be here with us. And I believe that our audience, they are thrilled to hear from you. Now, to our audience, we encourage you to ask questions of our panelists. As an audience, you should see a control panel with controls such as the audio options. We also have the chat. These are all connected to the Zoom platform. If you need to raise your hand and ask any questions, please, you may do so by using all the facilities that are available with the Zoom platform. We also ask that for the purposes of this forum, we ask you to submit your questions through the chat feature for the Zoom platform. It is the best way of getting your views all known so we can channel it to our panelists for them to answer all your questions. We will make sure that we address all questions at the end of today's deliberation. And so please submit your questions and we will be glad to do so. Now, just to put it out there, we say that our discussions for today is in partnership with Beyond the Return. And the topic of our discussion is the inner conversation. The elections are taking place in a democratic atmosphere. As the world wrestles with the novel corona pandemic, what are some of the challenges facing Ghana? And I would want to straight out go forward and surmise that the COVID-19 pandemic poses a significant challenge for African elections, especially Ghana. As countries, as we all know, continue to practice social distancing, the realities of containing or continuing community spread of the disease presents numerous hurdles to the traditional way of voting or the process of doing so. Governments will have to weigh the trade-offs between public safety and democratic imperatives. Leaders who decide to hold planned elections risk obviously hastening the virus's transmission. Ghanaian voters are facing the most unprecedented prospect of electing a president and a legislature amidst a global pandemic. The government has shepherded the country to date. We applaud the government for doing so, and they've diligently done that. And we applaud them for doing that. However, the prospects of electioneering during a pandemic is definitely in uncharted waters. Therefore, my first question to our panelists is that given the need for social distancing and the uncertain timeline of the pandemic, what are the greatest risks you see to the forthcoming presidential elections? And I believe that this particular question, we want to give it out straight to Honorable Ursula OWUSU-EKUFUL to open our discussions for us today. So, Honorable, thank you. And this one goes to you.
And we see in terms of campaigning, crisscrossing the country, engaging with the electorate, selling our manifestos and message to them. Even the election timetable itself from the Electoral Commission has been impacted by the pandemic. The lockdown necessitated the postponement of the registration to this period instead of April, which was originally targeted for the registration of voters. Now they have a very strict timeline. After the registration, there has to be an exhibition of voters to finalize the register before filing of nominations, and then the actual handing over copies of the final register to the parties. There has to be transfer of voters for those who want to transfer their votes to other places. All these timelines have been impacted by the lateness of the registration. Not only that, how are we going to campaign in this era? We've seen the NPP have its parliamentary primaries and select its presidential candidate right in the midst of the pandemic, with all the challenges that raised for all of us. For the first time, we had to do it for the selection of the parliamentary candidates. We had to do it on electoral area basis. It's normally a time when everybody comes together, there's excitement. We use that as a means of kickstarting our campaigns. Shortly after that, the flag bearer would go around. There'll be a national delegates conference at which the candidates will be introduced to the country at one forum. I don't know how we're going to be able to do that, because it will definitely breach the 100 person limit for social meetings. And we're grappling with that as well. Even if it's going to be done on a constituency basis, I don't know how we're going to gather all our people together. The challenge is our lack of self-discipline in this country. Despite knowing that we need to apply and abide by the social distancing protocols, sometimes you can't blame people. In the heat of the moment, we forget ourselves. And we've seen that during the primaries. We are seeing that during the registration. I have been around several registration centers, and people are bunched up together, not observing social distancing. But when they see either the security officials or a senior person coming to the registration center, then they put gaps in between themselves. So they know what they should do, but they won't do it until there's an authority figure. What we need to do is to enforce the rules, but that also comes at a cost. Are we going to throw people in jail for not wearing face masks? Are we going to fine them for not wearing face masks? That's what the law says we should do. What will be the impact on that, even for the electioneering, the chances of the government in power, which may probably be seen as being implementing draconian measures merely to enforce social distancing? Those are practical challenges that we face. Now, how are we going to do our campaigning? That is going to come once the registration is over. And we do have a very competitive spirit when it comes to our elections. The heat is already showing, and the passions are already flaring up with the few incidents that we're seeing around the registration process. Once we move into full campaigning mode, how are we going to do it? We can't have rallies. It won't be possible to have the normal rallies that we're used to. I am fond of having night rallies for me, because in my constituency, most people go to work. And so it's easier to get them after 6. So we can have our rallies all night and end up around 2, 3 a.m. That's the style that we adopt. And I don't know how we're going to be able to do that. There's been talk about having town hall style meetings. But my experience is that once the people gather and when they're caught up in the mood of the moment, it is almost impossible to get them to apply the social distancing rules. So we're going to be faced with a major challenge. We have seen the flag bearers of the 2 main political parties visiting registration centers. And even in those interactions that took place, we've seen the social distancing rules being broken. The people congregate, and you would keep telling them, move apart, move apart. They're not going to, they don't willingly obey those rules. So how are we going to have an election which isn't going to lead, or campaigning period, which isn't going to lead to a spike in the number of cases that we have? I'll leave that for the doctors to tell us. But on a practical level, we really do have a challenge. There's been talk about using social media platforms to campaign. But then again, you're going to have to come up against a very practical difficulty. How many, we had over 10 million people voting in the last election. How many of those have access to the internet? And even if they do, will they use the data to listen to or read messages online? And how many even have connections to networks, connectivity where they are to be able to do that? We have a very vibrant social media space. However, it is limited to the younger populations, the more literate folks, those who are more comfortable with technology. I've found that many of our older folk are technophobes, and are not that conversant with technology. They would make and receive phone calls, send text messages. Some will do WhatsApp. But when it comes to the Twitter, Facebook, Instagram, that space, they're largely shut out of it. So if you're going to use that medium to reach the electorate, then you are limited in the population, percentage of the population that you're going to reach. We're going to have to use more radio and TV, but then we come up against the fake news and misinformation that is also being put out there, which we also need to address. Now, it will be incumbent on the state to address that. At the pain of being accused of infringing on free expression, where do we draw the line between enforcing the law and ensuring that only the right information is put out and people aren't unduly maligned? We have all manner of challenges that we need to address. So I'm just throwing this out there so that the panelists would discuss it. But from where I sit, these are some of the real challenges that we face. Other countries have had successful elections during the pandemic, and Korea comes to mind. There have been a few countries in Africa that have also done so. Some didn't even bother with social distancing rules, especially those African countries that have had elections. In Korea, we saw beautiful adherence to social distancing, but we can say that it's because of the discipline that the Asians are used to exhibiting and their respect for the rule of law, as against our more laid back, relaxed attitude to most things, which also translates into how we really obey the rules that have been put in place. So we do have a real challenge. I'm hoping that with increased education, sensitization, and drumming down the message, we will get it. But my fear is that when it comes to the crunch, you will have people congregating to hear the message that the various parties have to put out. They will not observe social distancing rules. We may be challenged in whether or not we can enforce the law that has been passed, and we may unwittingly be opening ourselves up to further spread of the virus if we don't get a handle on it before we hit the peak of our campaigning. Those will be my opening remarks.
Thank you so much, Honorable, for your summation. And you've laid out the exactly what is happening on the ground back home. So taking a closer look at social distancing and COVID-19, we all know specifically that the president, and for that matter, the government, has done a tremendous work in trying to protect the population from getting infected one way or the other. So from a panelist point of view, linking up to what our minister has just laid out, what do you think are some of the basic, we're talking about, uncertainties that we're still going to be facing related to infection? So I'm going to be talking to our professionals. I'm talking about the doctors. So over here, Dr. Collins Kwarteng, if you want to come in, or obviously Dr. Alex Jodu, if you want to come in over here and chime in on what are your perspective on exactly what Honorable had just laid out in terms of some of the challenges that we are facing right now, and going into the election from the physician or from the cardiologist point of view. What are your thoughts on this?
Thank you very much for the opportunity to address our listeners who may be listening from here in the United States and hopefully all across the world. I'm very honored to be selected on this panel. There is an adage in Cree which goes like, say, abofra ehunin sahofra and only empening for etun sedidi. So to have the opportunity to sit at the table with state ministers, people in my profession, and also elders of state whom I've looked up to for quite some time, it's really an honor and I just have to put that out there. So I will leave the political aspects to the politicians and just try and stay in my lane and try and shed light on what I think the potential issues are from the medical standpoint. I think up until now, since this disease was first announced in Wuhan, in China, somewhere around December of 2019, up until now, we are 7 months into what started as a small recurrent respiratory infection, and it has blown up into a global pandemic. And when we thought we had a handle on it, we are starting to see across the globe a second spike. I think in our lifetimes, this is unprecedented. I mean, as a country, we are 60 plus years out of independence. So I would like to sort of restrict it from what we've seen from a healthcare perspective since independence. This is without a doubt the most challenging health issue which affects our population since independence. And how we handle this is going to define the very survival of our nation going forward. I think we know how the virus spreads. We know it's a respiratory virus. It is an efficient virus. Now, we've seen the types of this virus in the past, in the MERS epidemic and in the SARS epidemic. The mortality of those two viruses were high, but it was nowhere near what we have today. If I may give you some statistics, as of this meeting, 14.1 million people have been infected by the virus globally. And out of those infected, 603,000 people have succumbed to the virus, a case fatality rate of about 4.3%. In the United States, as of today, 3.7 million have been infected, and the numbers are rising. Yesterday, 75,000 new cases were reported. 141,000 people have died in the United States due to the coronavirus pandemic, a case fatality of 3.8. I checked from the Ghana Health Services website this morning. 26,125 people have been infected, and the cases continue to rise. Out of that, 139 people have passed the case fatality of 0.5. Now, if you compare these case fatality rates, it is quite remarkable. Now, we've been stuck on that 139 for a while. And if these numbers are what is actually happening on the ground, then comparatively, I think Ghana has done well and continues to do well. Now, if you compare our neighbors to the East, Nigeria, 35,000 people have died. 35,000 people have been infected, 772, case fatality of about 2%. So by the numbers, when you look at this and you look at the fact that, and what the minister just alluded to, the indiscipline, and sometimes it is not just indiscipline, but it's just the reality of life. People who are on the ground in Ghana are trying to survive. If you are the head of your family, you have to go out there and struggle to make ends meet, to put food on the table for your folks. And sometimes poverty sort of dictates our behavior and what we have to do. And so purely from the medical perspective, it is really going to be a challenge. Now, I have had the opportunity to witness through some of our collaborative efforts with our counterparts in Ghana, helping sort of manage from the periphery, managing ventilators and giving talks and education. We really have, even prior to the pandemic, we had a constraint on healthcare services. And with the advent of this pandemic, it is going to be worse. It has been extremely challenging and it is going to be challenging. So if there is one thing I can say, it is the fact that this is not the time to rest on what we've achieved so far, but rather the time to actually double down on our efforts to do whatever we can. The very survival of our nation is at stake. And history is not going to judge us well if we don't handle this trial moment well. You know, you say, OWUSU-EKUFUL and Quantum Pomono, so no America. So are we going to run away from this challenge, or are we going to man up, stand up, and fight and do any and everything we have at our disposal to tackle this issue? And from the medical perspective, I can only see the numbers going up. There is going to be a point, and I don't want to be a bearer of bad news, where our hospitals are going to be filled to capacity. People are going to show up to our emergency rooms, and we will not have the personnel or the resources to handle the influx. And so, like I said earlier, now, I'm not a politician, and so I'm going to leave the politics to politicians. But what does the Constitution say? In times of emergency, what does the Constitution say about running an election, for example? That is not my forte, and I'll leave that. And so I think I'll pause here and sort of hand the baton to my fellow medical professionals to handle the issue.
Thank you so much, Dr. Kwarteng, for your summation. And I believe that you've also laid a massive of a groundwork for us to also look at it from the perspective of a healthcare practitioner. So, Dr. Alex Joju, what are your thoughts? What do you see in terms of some of these risks and obviously on certain charted waters that we find ourselves in going into this election from your point of view?
Thank you. And once again, I'm speaking from the Ghana Standards Authority. I know Dr. NSIAH-ASARE, who is on the presidential team, is also online on the iPhone. And at some stage, he's going to speak. Thanks, Doc, for your professor, for your inputs. So COVID and elections, what are the risks? I think I would like to start from the backside. Clearly, Ghana, it's not by accident that Ghana is where we are in terms of COVID. I think His Excellency we took the decisions that we had to take as a country quickly. We locked down the country. We are testing. We are treating. I mean, we are tracing and we are managing. Our case fatality is not as high as others would expect, and we thank God for that, because it could have been worse. Currently, as you rightly said, we have, I mean, as of today, we've had just about 26,000 infected. Only about 4,000 of them are active cases. We've had 144 deaths, which is roughly 0.6% fatality. So before I go even into the risk to the elections, let me just give a general feature of COVID in Ghana. Like elsewhere, COVID is here and it is spreading. That is expected. Like elsewhere, the features are that about 90% of cases are asymptomatic. We don't even see any signs and symptoms. Unfortunately, you have 5% or less presenting with mild to moderate symptoms, of which about 2% get more severe conditions, and unfortunately, as we said, 0.5% dying. So after nearly 130 days of COVID in Ghana, we have a clear idea of what is going on. Now, we need to add that to what we call managing malaria in the age of COVID. Why? Our biggest health challenge has always been uncomplicated malaria. Unfortunately, that also presents with headache, fever, temperature, vomiting, diarrhea. And so we are having to do two things at the same time: managing malaria, which has nearly identical symptoms as COVID, as well as managing COVID. But we have been blessed, we have been lucky, and time will tell why we do see the outcomes we are seeing. Yes, a lot of this has been due to our testing and tracking, but there are some as yet unknown reasons. Now let's come to our social distancing, the risk to our elections. I think the first question one has to ask, coming from a policy point of view, is that are we doing what we can based on the resources we have, the epidemiologists we have? The answer is yes. And I know the Honorable Minister is very soon going to probably tell us all about the President chairing the regular COVID meetings, because the leadership from the President has been clear, direct, and regardless of what colors you wear politically, it's textbook style as far as managing health crises are concerned. Leadership from the front, clarity in communication, transparency in everything. Now, what are the risks to the elections? For me, the risk to the elections should be balanced with I would say, the case load for COVID, because COVID has killed 144 people. That is extremely worrying and disturbing. However, when one looks at our fatality, all-cause mortality in Ghana, and I have mentioned this week on a radio station on Oman, that in Ghana, roughly, our mortality figures are about 750 deaths per day. So from the 12th of March till now, we have lost roughly 95,000 people to all causes, all other causes. That, for me, is a significant factor to take into consideration, because our decision-making for the country should not be based on counting just one disease, but looking at the bigger picture. Malaria probably is killing about 20 or 30 every single day. So, I mean, we need that balance, and it's impossible to get it correct in an election year where the passions are heated, because clearly the government in power, is planning for election. I am a government appointee, so I have to declare my conflict of interest that I support the president's vision and his mission. So paint me as NPP, and I am. So at least it sets into context my views. Nonetheless, when you have in 130 days, 144 deaths, when you are getting heart attacks and other things still killing people, we need to go back to the question that what is informing our decision, even on opening up the country? The key things have been, one, are we getting overwhelmed in our hospitals? And I would add that, yes, we are seeing increasing attendance in hospitals. That is a fact. It's not reducing, it's increasing. Is it getting to the level where we are not able to cope? Not yet, and we pray it does not get there. Are we able to manage the cases? Yes, unfortunately, we are still losing a few. Now, for the elections, what should we do? We need to do social distancing clearly. But when you have an election where passions are heated and where several different groups of people, not just the opposition, but several different groups, social media activists, and indeed other Ghanaians actually choose to put out information which is incorrect, you can see that you want people to be socially distant, yet you want transparency to be real and active. I mean, if the president says stand 1 mile away, they'll say, hey, he's going to stab the boxes. If people stand close, they are going to be risked. So it's really standing on the shaky platform and shooting a moving object. I have no answer to that. I will leave it out there. So I would say that we need, one, pragmatic decisions based on the reality of the Ghanaian psyche. Really, you cannot do postal voting in Ghana, out of the question. Nobody believes anybody, which is fine. We are Ghanaians, we know each other. How do you do social distancing in a polling station? It's really a challenge. How do you avoid illegal peddling or falsehoods? That's also another challenge. So in sum, what I would say is this. The Ghanaian expertise, fortunately, across the political divide, have come together based on the president's call to support the president in terms of how to manage COVID. We believe that within the resources available, we are doing a good job as possible under the circumstances. We see real risk to the election, and indeed, one may even ask whether the outcomes will be the best. It cannot, because people are being campaigned, people are being appealed to emotions as we normally do. So it's a weird election. But nonetheless, the alternatives of having no election is something we don't even want to think about, because it will just be chaos, especially since all sorts of people in this country, the opposition, civil society groups, to raise other issues. So we throw us back again to the panel that yes, the election will add to the caseload. And even if mortality remains at 0.4, a few more people will unfortunately pass away. By putting that into the bigger picture, what should we do? I'm sure you don't want an answer from me yet. As the discussions go on, we'll come on with more information. Thank you.
Thank you, Dr. Alex Dodu. And I think that your summation actually fits into the next line of questioning that obviously we're going to put across over here. And I believe that the most obvious risk, as we are looking at it, based upon even from the cardiologist point of view, is the risk of infection as we are looking at it. Think about it. Ghanaians are out there, in their large numbers. And when it comes to polling, they're going to be out there voting. So the tendency to coalesce around each other is very, very high. And therefore, the tendency for infections are going to be very, very great. Therefore, the consequences of reduced turnout, especially with the elections, will be catastrophic for Ghana's democracy. So not only would it deny a voice to millions of Ghanaians, but I also believe that it would throw the legitimacy of the outcomes into question. So the question is, what steps have been put in place specifically to allay people's fear of contracting the infection of COVID-19? Because people are going to be out there voting. Okay. So what steps have been put in place to allay people's fear that yes, I can be out there voting, but I'm not going to be contracting COVID-19. And I believe Dr. NSIAH-ASARE, Doc, if you're on the line, you want to chime in on this one?
Yeah, thank you very much, and thank you for inviting me to this August conference and discussions. I'm very happy to be here, and Professor Dodu, my younger brother, has said it all. Yes, whether we like it or not, there's COVID-19. But the story of Ghana, as he said, is slightly different from the story in other places. And for that matter, the story in Africa. We are seeing cases, but as he rightly said, the cases we are seeing is not very sick patients as you see in the other parts of the world, in Asia, in Europe, in North and South America. Africa maybe is spared. We are spared, but we are not completely spared because of importation. If you remember, our first 2 cases of COVID-19 were all imported into the country. And we know that because we've done genome sequencing and really pinpoint where the first 7 cases that we did the genome sequencing at Noguchi came from. So we know about that. That's the reason why His Excellency the President, with the advice of the task force and the scientists who are backing him, decided that we should close the borders. And as we speak now, the borders are still closed. So we've checked that. And then we realized that the only way that we can find out the number of people who are infected and also to know what is going on is to contact trace. So we are searching for the people, tracing them, we testing them, we isolate those who are positive and also manage them. Most of the patients that we see, as I said earlier, who go to hospitals are very mild to moderate cases. As we speak now, we have about 25 people with severe cases, with 8 of them in critical conditions and 5 of them on ventilators. So if you go to our hospitals, we realize that most of our ventilators are spared. We have also are lucky because we have some hospitals that we have just opened. If you come to Greater Accra, we have a whole hospital, in fact 2 hospitals which are just for COVID-19 management. We are doing the same thing in Ashanti region. God being so good, our fatality rate is also less than about 0.5. It hovers between 0.4 to 0.65%, which we are hoping will not go up. Luckily, we've also put in a lot of measures. And I think the physicians on board and the health specialists on board will agree with me. The most important interventions is a prevention of measures that we have put in place. Social distancing, and as Honorable Osla said, social distancing is very, very difficult, especially in our circumstance. But we are trying. And then we have also put in place mandatory wearing of masks, which everybody is wearing. Unfortunately, we've also seen people wearing only face shield, which we are educating people to make sure that you don't put on face shield alone. Face shield is worn at specific areas. And then we are also doing the hand hygiene and hand wash and the use of sanitizers. So this all brings opportunities, and has brought a lot of opportunity to the Ghanaian economy. Now we make our own sanitizers in country. We are sewing our own face masks in country, which I'm sure those of you in the US, you can export some of them to you. It's very beautiful ones. But in doing all these things, we realize that this year is an election year. And I'm sure that's what you want me to talk about. This year is an election year. An election year, either we like it by the constitution, we have to, unless the constitution is changed, which I'm not sure will be changed now. I don't know who will start it. If His Excellency the President starts, they say, yeah, he wants to hang on to power. If the opposition, largest opposition party also can say, hey, they want to come and share power. So we go on of the elections, because we have seen other countries in the midst, at the height of COVID-19, for example, in Korea, they had a very successful democratic election, very free and fair election. Even our own brothers in Burundi and Mali have all had elections, and they've chosen their leader. So why not Ghana? And luckily, the technical team and the presidents, which are part of it, we engage Electoral Commission, because we wanted to know what they are putting in place to make sure that they minimize infection among people who are going to register to the barest minimum. And when we met them, we were amazed with the sort of thing that they've put in place. The first round of the registration, they put in every measures of the hand wash, wearing of mask, checking of temperature, which they pick some few people who were having high temperature who came to the registration center. They allowed them to register, but they took them to hospital. And I'm sure a few of them were tested and maybe admitted for malaria and other things. Perfect. One of the problems that we have in this country is discipline. The problem of things which were happening were not happening where they are registering. And the Honorable Osla will tell you that they were happening outside the registration centers. Those who have not been able to get inside the room to register. But during the second phase, they put in measures to check the crowd control and everything. And now they are giving kits. Anybody in this country will tell you that, in fact, the second and the third phase that they are doing now is far, far, far better in terms of crowd control, and then also making sure that people follow the rules and regulations. We are learning. We will go and sit down with them again. We have had a Zoom conference with them to learn after the first two phases. And we have given advice, and we are happy with what they are doing. So going forward, things are not going to be the same as again in Ghana. I don't believe that elections will be like what you have been seeing, where people will be snatching ballot boxes, people will go and congregate at the election sites, and maybe, who knows, I'm sure maybe after this election, we'll all move into electronic voting, where people they go and vote and go away. Apparently, you don't need to vote and stand there and make sure that you count. That's where the problem is. So we are learning lessons from what is happening now. And I'm happy that we are engaging them. They are very open to any suggestion that the technical people give them. And I'm hoping, by the grace of God, we will have a very clean election where we will minimize any cross-infection with COVID-19 to the barest minimum. That's what we are going to do. The government is also trying as much as possible to social behavioral communication change, to also let people understand. A lot of people, especially, and they are right. If you look at the COVID-19 infection in Ghana, it is mainly within 4 regions. And even the 4 regions, about 75% of all cases are in Greater Accra, not even the whole of Greater Accra, but the Greater Accra metropolis and Greater Kumasi metropolis. It is an infection of mobility. That's where activities are very high. That's where people are. So if you go outside to, for example, Northeast, they had 2 cases, and for months, for about 2 to 3 months, they didn't have any case until recently, when we ease up for the tertiary institutions and the final year students to go and write the exams. Some people moved from Accra to go there, and then they were harboring they were incubating the virus. And then we have another, I think, 7 cases to add to make it 9. So somebody in Northeast doesn't think that there's COVID-19 in office, and that's where the problem is. So going forward, we are always learning and studying, evaluating, and making sure that we put in things to make sure that we minimize the disease to the barest minimum. And that's exactly what we are doing. But I'm hopeful by December, with the engagement that the technical team is having with Electoral Commission, will come out of an election that people will come to Ghana to come and study from us. But, and the big but is that I believe, I know that our colleagues in the US are all looking at what is happening in the US. I know Dr. was telling us that, oh, our hospitals are going to be swamped and our emergency rooms and everything. But God is on our side. Right. Some people who don't have, the same people that God also covered them with their wings. And that's exactly what is happening in this country. And I'm very hopeful, and I believe strongly that we will not get where we are with all the measures that we have put in place. As Professor Budodo said, His Excellency the President chairs the Presidential Task Force himself. And sometimes we meet, sometimes we talk, and every day we are briefing him. All what we are doing now is COVID-19. To extend that, as a health professional, and as a previous Director General of Ghana Health Service, and I've been in the management for a long time in health, this is the first time in the history of this country that health has been put as #1 priority in this country. So we are using that opportunity to strengthen our health systems and make sure that we will not go back again. As Prof. Dodo said, there are other diseases which kill more people than COVID-19. The morbidity, for example, of malaria alone is very high. Pregnant women dying from pregnancy and pregnancy-related disease is very high. And we have now realized that the people who succumb to COVID-19 are people who have comorbidities, namely hypertension, diabetes. So within the National New Patriotic Party's manifesto, we put it in the manifesto, in the 2016 manifesto, that we will have wellness clinics across the country. We have started, and the president is now charging us that as quickly as possible, we should scale it up so that we have wellness clinic for the lowest center to the highest center, which I call adult weighing, so that people will know that their status, that they are diabetes, they are hypertensive, and seek treatment before they reach a stage where they cannot have.
Thank you so much, Dr. Anthony NSIAH-ASARE, for your summation. I want to welcome everybody to our platform today.
But we are now in work well. I'll stop here, and then as the discussion goes on, I'll unveil other things that we are doing as a country, all the other strategies we have put in place. But as at now, we've realized that the care of the sick, of the COVID patients, is also very important. And we are strengthening the care of the sick, looking for places where we have isolation centers, we have treatment centers, and then we'll bring our scarce intensive care nurses and intensive care physicians together to make sure that we have to maximize the quality of care we are giving to our patients. Thank you.
Thank you so much, Dr. NSIAH-ASARE, for your summation. I want to take this opportunity to welcome everybody who is on our forum for today. This is Ghana Advocacy Group, GAG Global Forum. This forum is in partnership with the Beyond the Return. This is an inner conversation on the topic. The elections are taking place in the democratic atmosphere in Ghana. As the world wrestles with the novel corona pandemic, what are some of the challenges in Ghana? And we are privileged and honored to have among our panelists for today, the Honorable Ursula OWUSU-EKUFUL. We also have Dr. Anthony NSIAH-ASARE. We have Honorable Kojo Yanka, Dr. Collins Kwating. We also have Dr. Alex Duodu, Professor Eric SAMPANE-DONKOR, and Ms. Awo Chumesi. At this point in time, I want to welcome Ms. Irene Hersham, who is our co-moderator, to chime in with the second line of questions. Thank you, Irene. Come on board.
Many apologies. I don't have my video on because I've got my children over here in a very messy situation. So I will come in with a question. And I think my question is going to be one of those very tough ones, where because of the nature of the panelists we have today, we are all very mindful in terms of answers that are given and everybody throwing out the difficult parts out there and not actually tackling the very difficult issues. So I'm going to try as much as possible to pin our panelists down to the very difficult issues, which is part of the reason why I think we're here. So we start off on the point that this is not a political discussion, it's apolitical. But then, because we're talking about an election year, there is some element of politics involved. On that basis, the point of mobility that has been raised by Dr. NSIAH-ASARE and the issue of how the spread has happened in the recent weeks, I'd like our panelists to address the issue of political activity and how that has contributed to the spread. Because before the political activity started, we knew where the cases had been concentrated. And we know it was in the Greater Accra and the Greater Kumasi areas. Now, post, for example, the primaries, where the mobility moved out of Greater Accra and Greater Kumasi into every single constituency in the country, with mobility of people, how would we then talk about the election and mobility because of voting people out of these areas where it's concentrated into areas like the Northeast, for example? What I think would be interesting would be your comments on political activity and its contribution to a possible spike in numbers. So I think on that basis, I wouldn't throw the question to people in politics in general, but to the panelists in general to comment on what they believe would be a contribution of that political activity in terms of mobility. Thank you.
I'll come in before anybody comes in, because we deal with the figures.
Okay.
I believe strongly that the political activity, the primaries have not made the surge. There's no any surge after the primaries. I don't believe so. We still have the greatest number of cases still in Greater Accra and also Ashanti region. The other regions like Western region, we know why we are having a surge there. It's normally from the offshore drilling of oil. That's where we had a lot of the cases from, and their contacts, and also from the mining areas. And then Central region, also we know Central region, Kaswa and the rest are also contributing to what we have there. Sometimes for the whole about 3-4 weeks, most of the regions don't even record a single case. Not that we are not tracing and testing. I'll give you an example. We test, Bron region was testing almost everybody who is crossing, coming from Cote d'Ivoire, and then sometimes they block the road and take samples. For a long time, they didn't even get any one case until a time that an illegal person crossed the border, and they have to test the person and send the person back to Cote d'Ivoire, where he's coming from. So it is not true that after the primaries, we got a surge in all the regions. That is not the case. 2, we know that we don't have a lockdown. So people are moving from Greater Accra, even without political activities, to other regions. But still, we haven't seen any such massive or any significant surge in the other regions. That is how it is. We also realize that what we are having is in Greater Accra and Kumasi, we're also seeing some cases in workplaces where they also go in bulk to do what you can call mass testing and then you get 1 or 2 people who are positive, and then you continue testing. That's the reason why what we are seeing. But the most important thing, most of these patients are asymptomatic, who are also the dangerous ones, which may go and infect somebody who has comorbidities or somebody whose immunity is low, and then we have a problem. So going forward with the elections, I believe that I will say that maybe because we have a lot of malaria deaths in this country, maybe you can say that malaria is not by morbidity or something, mobility and all sorts of things. But we can still look at what other countries have done, where the best practices that they've done, that they had also elections during the when the pandemic was very high. When that time we didn't even know much about COVID-19. Now at least scientists know a little bit about COVID-19, and we can learn from that. And I believe strongly that of the measures that Electoral Commission, who is in charge of the elections, have put on paper, that they have now put into practice during this registration, if Ghanaians follow it, we can have a very successful election with very minimal problems after the elections. My problem is not during the election day, but after, post-election, or the celebrations, either you like it or not. That's what you saw during the primaries. The primaries itself didn't cause much of a problem. People were in queue and they voted, but it's after the person has won, and then they said, you cannot, sometimes it's difficult, as Honorable Osler said, to stop people from jubilating. You remember also, during the announcement of the largest opposition party, NDC, when they also nominated their vice presidential candidate. After that, there was a press conference where there was no social distancing whatsoever. And what worries me sometimes, which we have also been talking about, is when people wear masks, and when they are going to speak to people, that's where they remove the mask. You can easily speak through the mask, especially when you are using a microphone. And that is what we've been telling people, that wearing masks, the most important time that the mask even has to be on is the time that you are making a speech. We went to Parliament and I told them the same thing. You don't pull your mask to your chin when you are debating, or wear a shield alone and you are debating. And I'm happy that they started doing what we at least educated them and taught them what to do. So going forward, I believe that the election and the campaigning, as Honorable Osler said, is not going to be the same. Either we like it or not, we have to now come out of innovative ways of campaigning. And I believe there will be more of town hall meetings. There will be more of people meeting people in small groups. There will be more of the use of social media. There will be more of the use of the media, both electronic and print media, for people to know what people are doing and what you can do for the people to vote for you. And that is what is going to happen. We, the technical people, have not, or the president has not come out easing political activities. What was done was that political activities can be done by not more than 100 people. And that is not rally. It's mostly meeting people, having your activities and completing whatever process you haven't completed. So going forward, that's what we are going to do. We have planned, the technical team at the COVID task force have planned to do exactly what we have done with, we did with Electoral Commission, also to meet the political parties, maybe by a Zoom conference where we can have all of them together and let them also throw ideas to us how we can do this and do it properly to have a very safe elections on December 7th, and also about 2 or 3 days after the elections when the results are declared. So this is what I will say, and I want to stress that it is not the political activities which happened about 2-3 weeks ago and also about a week or 2 ago that has made figures gone up. The figures went up, which have been explained over and over again by the Ghana Health Service, that we have some problems with logistics for testing. So most of the figures that we see today, and we have been seeing for the past 1 week, are tests which dates back from about 2-3 weeks. Luckily, last week and the end of this week, we've gotten logistics for 3 months logistics, which we have placed another batch of things, test kits and other things to come. And we are hoping that we'll be able to test about 20,000 people almost every month, so that we go back to where we are, and then we make sure a test doesn't last more than 48 hours. Thank you. And we've added also a lot of laboratories on board now. Now we have even the private sector, which has come into the testing. As we speak now, NSIAH is testing. Akai Hospital, Akai Clinic is good. It has also taken their machines through testing by Food and Drugs Authority. We have guidelines for anybody who wants to join the testing, either private or public. And we sign agreement with them so that we capture all their data onto the database. This is what we are doing. As we speak now, plus NSIAH Clinic, we have about 11 testing sites. The gene expert machines have also, we're having the cartridges which are in now. We are going to now make sure that every region of the 16 regions in this country will have a gene expert machine, which will at least do some of the testing, and then the bigger centers will do the mass testing, so that we can relieve the testing size and then we can have our results as quickly as possible. Thank you.
Thank you, Dr.
Thank you. Yes, thank you for that explanation. It was a very full and a good explanation. But before the other panelists come in to add their comments, perhaps I can narrow the question down again by defining what I mean by the contribution that political activity makes. I am not referring to direct political activities by politicians, but for example, what you said about celebrations following political activity. What I am asking is whether there are measures in place following political activity that is coming, which we all said cannot be avoided. And I think if I may open this up, not in terms of what is in place by those in the technocrats involved, but if, for example, if I may come to you, Mr. Kojo-Yankah, about what you would like to see in place in relation to political activity and its related outcomes for this election, in terms of not using mobility to increase cases, because that will be inevitable if people move out of Accra and Kumasi. Thank you.
Well, Dr. Ampofa, I hope I have your permission to make a comment. I've retired from politics a long time ago, but I can give you my open ideas in terms of what can be done. Let me, first of all, thank Professor NSIAH-ASARE and my friend from Standards Board, whom I know also very well, for the pieces of information. Now, let's put it this way. The government has taken the risk already. This beginning from whatever that decision was taken for us to, to go on and with activities, the decision, has been taken, and I believe that the whole of Ghana is following the protocols. Now, Dr. Ampofa, you started by saying that we are in a democracy. Several months ago, I would have said that in a crisis such as this, particularly with a disease like COVID, which we are still debating over in terms of even causes, and almost every week we have the WHO coming out with some other findings. So as far as I'm concerned, despite all the hard work going on in Ghana, unless of course there is something that I do not know, the world itself, and I'm not talking only of Ghana, the world itself is still not very certain that we have found all the causes, let alone to find the cure. So I'm saying that in taking any decision around this time, it is not a normal time. So once you want to take a decision, and of course in politics, you have to take some risks. In business, you take a risk and all that. So I'll say that as a nation, we have taken the risk of going forward. The question is, how do we cross this barrier? We've come low numbers, and Professor NSIAH-ASARE, thank you very much for believing that God can be kind to a country, but I also believe that God is kind to everybody wherever we are. And that's why people in South Korea and other places have been able to go through their elections without much problem. But I want to point out, from a sociological point of view, that the habits of people in Asia are totally different from the habits of people in Ghana. Again, we're looking at social systems and political systems. In East Africa, you'll find that at the time that they took a certain position, not for people to fear that there was a disease. So again, they were taking a risk. Look at Madagascar, took a risk. There is no COVID. Everybody drink something. So they went about it. Malawi, Tanzania, we know their systems, coming out of one-party systems and so on, although now there's a lot of challenge there. But again, they tried as much as possible to let their people know that don't fear, we'll get through this. It's totally different from the road we had in Ghana and other parts of West Africa. So the point I'm making is, if we are looking at our situation, we should also not look at it in isolation. Whether we like it or not, we will open the borders after elections or even before. Whether we like it or not, we will still be part of ECOWAS. Whether we like it or not, we'll be part of the African unity and so on. We will have trade. And then again, election is only one activity in a democracy. Look at business. We've been able to lock down business. We have 30% of active working force working for the economy. Now we have the informal economy, the 70%, who cannot do without heading together and so on and so forth. I'm sure your committee has taken care of all this. But I'm saying that in the next couple of months, elections cannot be this, the preparations towards elections cannot be the same. We cannot have rallies as has outlined. We cannot do the kind of things that we were doing before. So now our mindset should be that, okay, this is going to be normal. Let's say that this is going to be normal for 5 years. So for the next 5 years, this is how we are going to conduct elections. If we psych people that way, to understand that we are going to have this situation in the same way that people are now working from home, in the same way people are making money, in the same way that people have to find a way of surviving within this COVID period, we should be able to find a way of having the elections. So what's my direct response to your question? My direct response is that we should all agree that this situation is for the whole of the people. It's not just one party or anything. It's for Ghana. How do we traverse it? And what are we going to do? I don't think that Professor NSIAH-ASARE and his team have answers to what will happen even in December. They can only conjecture. Because at the moment, we are hearing that the disease is airborne. Now, what that means to the conditions that we are managing in Ghana, I have no idea. But if we are only saying that, oh yes, the figures, I love science and I love what is going on. But it's because Upper East or Upper West or other regions are not suffering because we have put a hold on mobility. Is it a situation that is going to continue up to December and beyond? Are we going to free the system to allow more people then for us to now agree that this is the reality? All I'm saying is that we do not want to give a certain impression that, oh, this is only for the election. I hope you understand me. We must psych our people to understand that if this is what, now we call the new reality, whatever, then let's psych our people to know that it is going to happen and that people can travel and that people can do this, but they must take care of this and that. Or people can go for rallies, but they should take, these steps. I think that's the way we should be thinking. And also not make election look like without it, Ghana, there's nothing going to go on in Ghana. You can have elections, and if at the end of the elections, you have, wild numbers of people still not alive, what are you going to do? You don't want to go and have funerals after an election. No. It should be, I want us to consider it as one of the activities that makes a country run. Now look at most of the people who live on just crossing the borders for trading. For a long time now, they cannot make any money. They are not, their survival is threatened. So it's not just election. Election is only an activity. So let's think about the wider perspective. If we are going to sack people, and we shouldn't do it alone, in my opinion, we should do it with the rest of our neighbors across the borders. There are many Ghanaians, there are many Togolese, there are many Ivorians, so who cross the border every day doing intra-African trade. So I'm not so glued to the specific activity of just election. I want us to look at the totality of movement of people, life as usual, but let's remember that these conditions are uncertain. Any new finding can come up, and I'm very sympathetic, Professor NSIAH-ASARE, I'm very sympathetic to our own situation where malaria and other diseases are killing more people every day than COVID, except that up till now, doctors throughout the world are still searching. They are still searching for what are the real causes. How long does it take for you to, if you have it and you recover and all that, a whole lot is still untangled. And unless we put all this together and do extensive education of our people, and don't blame anybody, don't tell anybody that he's indisciplined. That's the behavior of people. You want to change it, shift it to another format. It is education. It is not using the police or even using the law. Changing behavior is a communication function. And therefore, a whole lot of comprehensive activities have to take place to get people to change over time. It is not just for this election. As I'm saying, let's get it clear. What is the situation going to be? What have we adopted as the norm? And let's work, educate ourselves, prepare our minds, and get everybody to understand that way. So that even when you open the doors of the borders or the airports and so on, we will have that sense in mind and work accordingly. I hope I've answered your question.
Yes, very well. Thank you very, very much for that. So I'll hand back over to Dr. Ampoma. Thank you very much for the answer. Very comprehensive indeed.
Thank you, Irene, for running over. Dr. Professor James Adjei, we have you on the line. You are part of the moderator team. You have a question, and please take the floor.
Members of our Ghanaian political scene. The question I have is basically it was mentioned earlier that God is on our side, and we are fortunate that we've had very low case of mortality, which is true. But why is that? You look at Italy, Spain, UK, you have a much higher population of what I'd call an aging population, so fragile genomes, so old age. So I think in Ghana, rest of Africa, we have the very low life expectancy. So I think what is our saving grace probably is the fact that we have a lower percentage of aged individuals, and that probably contributes to why we have lower cases of mortality associated with COVID. Then also was mentioned social distancing. I mean, that's very interesting because we think about this a lot here because we've seen that there's been a lot of demonstrations in, regarding like, let's think about, okay, the demonstration about George, you know, the Black American who was killed. Yeah, so Black Lives Matters. There was marches all over Berlin, over London, and we all thought, great, there's going to be a surge, but there's been none. So people here, even in Düsseldorf, where I am, I mean, of course, there are no more cases in the hospitals, but people are beginning to doubt whether social distancing actually is necessary. We still think it is, and we still wear the mask, we do all that. But let's put this back to Ghana. If we talk about social distancing, and you also mentioned that Ghanaians are stubborn, I think worldwide, we're all stubborn. In Ghana, if you look at, let's say Accra, we look at Nima, Chopo, maybe other parts which are very highly, very dense. Honorable OWUSU, your constituency, as an example. So I believe these people are bombarded daily with pathogens, and they've got fantastic immune system, I believe. Maybe, maybe not. So we talk about asymptomatics. So maybe these people might be the asymptomatics. Maybe they are the ones spreading it out. Can we can we agree on that, or maybe not? We don't know. But to figure out, so a good example is in Göttingen, Lower Saxony. It's a very affluent area, but they had, after the lockdowns lifted, one particular area is a high-rise block, apartment blocks, lots of mainly foreigners, those who need social support. And there was a massive infection over there, simply because you have 4 or 5 in a room, right? You have like 500 inhabitants using 2 lifts. So that was very clear that they are tightly together, and that is what causes. And they're the ones who are bringing it out. So they concealed the entire area to make sure, of course, you can't do this in Ghana. So my question now, in my suggestion question is, do you have any, because we haven't heard anything about these areas, which I've just mentioned, highly dense areas. Do you have any statistics of rate of infectivity in these areas? Or is that not being?
I don't know who the question is to, but Dr. Mpuma, who should take it?
I think, Doc, we have Dr. Sampane on the line also, who is part of our panelists. I want to give him the opportunity for him to chime in on this one. And then Honorable OWUSU-EKUFUL, you want to take a look at this question too? We would appreciate it.
Okay, thank you, Dr. Mpuma. Sorry, my internet is so unstable, so I've had to turn off my camera. I think the previous speakers have done a very good job providing us with the global statistics on COVID-19, then as well as the situation in Ghana. I agree with Dr. Kwat saying that the number of cases is continuing to increase, and it will remain like that for the foreseeable future. And this is because generally, for all the respiratory pathogens, it's quite difficult to control them, and transmission is very easy. So for example, about 1/3 of the world's population is infected with a TB organism, another respiratory pathogen. There's a high rate of transmission of strep pneumoniae. I mean, typically for the respiratory pathogens, transmission rates generally are very high. So we expect that the number of cases are not going to go down. going to increase. Dr. NSIAH-ASARE talked about the sequencing of the COVID-19 strains that we had collected in Ghana. And these strains were quite similar to what had been found in some of the European countries, which is true. I'm sure if we should do some further sequencing now, we may discover or find some new variants of the organism, simply because the organism continues to mutate, and that further supports the school of thought that the number of cases are going to rise. Because if we have a high rate of mutation, then there could also be reinfection, leading to an increase in the number of cases. So I think that generally, with all these events about the elections, we're going to generally see a rise in the number of cases. But then the good thing is that I think we also have to focus on the mortality data, which actually is quite low, about 0.5 compared to the 5% mortality rates globally, 4.5 to 5% global, the global rates. So our mortality rate is quite low, which I think it's very good. And the reasons for this lower mortality rate relatively, we don't know. There are several schools of thoughts. People talk of the superior immune system we have, our environmental conditions, so on and so forth. We don't have ample research data to support that. But probably some of these things may be true because we still continue to see a lower mortality rate, generally on this side of the world compared to some other countries. I'm sure further research will tell us more about that. It also puts that we have a high prevalence of asymptomatic infections. Again, the reasons for that we may not know fully, but if you put these two factors together, that's the low mortality rates and then the high prevalence of asymptomatic infections, it tends to partly disprove the point that Dr. Kwatin made, that we're going to see our hospitals being overwhelmed with hospitalization and the whole healthcare system going to be overwhelmed. That I beg to differ based on what we are seeing so far. And as Dr. NSIAH-ASARE said, by the grace of God. So I don't see that happening in this part of the world. COVID has been with us for some months now. And so far, that's what the data is showing. I don't think there'll be any significant, there may be some change, but I don't think that we will get to that level of our healthcare system being completely overwhelmed and all of that. The Honorable Minister talked about a lot of indiscipline, which is going to probably increase the number of cases. I agree with her. But I think something which we still haven't done very, very well in Ghana is public health education. Public health education. I wonder how far we have gone with public health education. I'm confident that if we do public health education very well, we are likely to see a decline in the number of cases, and that may further affect the mortality rate. The other thing which I think we also haven't done very well is that we haven't been very serious with research on COVID-19. Probably if we should have a research team on COVID-19, looking at COVID-19 research from basic sciences to the social sciences, we may understand a lot about some of the predictors of mortality, the reservoirs of fomites the different reservoirs which may serve as risk fomites for infection, and several other things. So if we put all these together, we show that we may see a decline in them. So it's true, the number of cases are going up. That is typical of any respiratory pathogen. The good news is that the case fatality rates are not so high. There's a lot of asymptomatic infection, which really doesn't show that we have, the situation is going to be very, very bleak in the future. And if we put in place good public health education, plus a solid research team to understand COVID-19 locally in our environment, I'm sure that we can deal with the problem.
Yeah, thank you very much. Maybe, moderator, if I can come in and answer Dr. Kwarteng's question about if you have done any study in the areas where the highly populated areas. Yes, our figures, if you go to Ghana Health Service website, shows where the cases are, the districts, and even the sub-districts. We have a heat map, which will even show you exactly where the cases are. So we can use the heat map, and then you see wherever we want to see the case. We are working closely together. You know, the committee the president chairs is an intersectorial committee. Honorable Osler is very technology. He's backing us with all the technology. And as I speak now, there's a Panabios, which can even trace whoever is positive and the contacts to the house that the person is. So we have all those in place. I think she will expand on it. The next point about research. Yes, we have people who have started doing research. You know, we have this disease about 14 or 13, 14 weeks ago. So there's a research team which is working on the biology, the labs, and then also social scientists are working on it. The clinicians are also looking at the various cases and coming out. Yesterday, I joined a webinar from Ghana Physicians and Surgeons Foundation, and Kolebu neurologists have been working on it and coming out the neurological aspects of COVID-19. So there's a lot of work going on, and we are very much concerned that we want to make sure that we give them all the support that they need to be sure that we have a Ghana case. We don't want to have the world case. So we want to talk and say that this is Ghana, what happened in Ghana. But I still say that, yes, we are seeing the cases. Once you test, you see. And I'm happy Dr. Ajay talked about it's a respiratory virus. We are going to live with it. It's not going today.
Yeah.
So because we are going to live with it, Professor Yanka said something is very important. The election is only one aspect of it, just once, and then to go. The next problem is that how are we going to go back to normal life in the midst of COVID-19? That's what we are working. That's the reason why the president started the easing from the 5th of June. And we said that we shall ease in phases and it will be strategic. We monitor it, evaluate it, and then ease again. The first phase of the easing will be ending on the 1st of July. I'm sure His Excellency the President will give his 14th nation address and tell us where we are going. What is the next? We want to have a normal life, but it's a new normal. The new normal means that until the time that we have treatment and maybe vaccines for it, we will be wearing masks, we will be observing social distancing, we'll be doing hand hygiene and hand wash and hand hygiene. That to me should even go on forever because there are other diseases like cholera and other bacterial infectious disease that hand washing alone solves. So this is how we are going about it. But I still say that with God on our side, we will not get to where people have gotten.
Yeah. And if I might just chip in a little bit here. The predictions made about how this disease will play out in Africa hasn't panned out. And that is the big puzzle for the whole world. I mean, from March till now, judging by how it played out in Europe, it is affecting South America, in Asia and all that. People expected that by now we'll be dying in droves, but it is not panning out. And so I do think that God is really looking out for us. We can't discount that. Yes, he does look out for everybody. But if the disease had worked out the way, played out the way it did in Europe, it is happening in America, in South America, if we'd seen the same effects here with the state of our health infrastructure, and it would have been disastrous. So what is it that is peculiar to us? I'm speaking from my layman's perspective here, and I'm sure the geneticists and the experts in that area will be able to give us a better example. But there's something that is protecting us from the worst impact of the disease. And sometimes when we're joking when I'm joking with my friends, we say that the virus enters into into somebody's body and says, hey, what kind of toxic environment am I in now? Because we've been exposed to so many things over the years that have built up our resilience and may helped us probably have a better immune system than other parts of the world. They said it was the sun. Well, it's summer and people are still dying in South America. It's as hot as it is here, but Brazil is seeing the figures that they're seeing. So it might be something worth investigating to see exactly why Africa is proving much more resilient than other parts of the world. Now, when you going back to some of the statistics that Prof. Dodu gave out, we ought to be more scared probably of malaria than we are, or we should be of COVID. If more people, how many 20 to 30 people die of malaria every day? And since March, we've only had 144 deaths from COVID. Yes, we shouldn't emphasize our fight against it because we don't know. This is a new virus which is still evolving. It could prove even more deadly than it has been. But we have many, many more present dangers which are more devastating to us than COVID has proved to be. It doesn't mean we should let down our guard, but it means we ought to put things in the right perspective. Yes, we need to follow all the protocols that have been put in place, but we should protect ourselves from the other diseases as well. And the emphasis on COVID is fine. It is good. We should continue to do that. I'm not saying we should belittle or downplay the efforts that we're put in there because we don't know what it will be. But we shouldn't lose focus on the other diseases that could have even more devastating impact on us. And while in the early stages of the pandemic, we had to deal with a CSM outbreak as well, which killed even more people within that same period than COVID did. So I agree with Dr. NSIAH-ASARE that we may have to learn to live with this virus over the long term and institutionalize some of the measures that we have put in place and let it sink into people's heads that we're going to have to change our attitudes, our way of life over the long haul. Instead of looking at it, people still think that this thing will pass over. It will blow over, but we're still, it's as if we're in suspended animation, waiting for this to end so that we get back to life as normal. We may never, ever get there. And so, yes, we need to look at how we're also using technology to help us in the fight against the pandemic. And there are a few things that we put in place so far, which are assisting with the contact tracing, are helping us to even identify the hotspot areas through cell phone triangulation and SIM, the phone numbers and SIM triangulation. We're able to find out where the hotspots are in conjunction with some of the other things that the Ghana Health Service is doing. We're about to roll out a meeting management module, which will enable us to even check in to meetings, identify which areas to avoid or to go in and to be properly prepared for, help with the opening up of our borders in terms of vaccine tracking and tracing when that does become possible and available in the world. So there are a few things that we're looking at. We're working on assisting the health service to set up teleconsulting platforms and telemedicine platforms so that even medical personnel who may have been infected with the virus, who are asymptomatic, can still work remotely to assist patients on the ward. So there are a few things that we're looking at. We're not out of the woods yet. And so I agree that we need to step up our public health education. We're doing a fair bit of that. And I must commend the Ministry of Information and the, what's the name of Dr. Awajida Costa's outfit? Yes, the risk communication unit of the Ghana Health Service. Yes, they're doing an amazing job. But I still say that we have had knowledge about this disease. Everybody knows about COVID, has heard about it, knows what to do. That translating into the changed attitudes is what the challenge is, and that's where our stubbornness comes to play, because I have seen it myself. People know they shouldn't be bunched up together, but they do. Whether that would also help spread the virus more is what the health professionals have been telling us. So we do need to change our behaviors. And I, for one, thought it wouldn't be possible for us to stop shaking hands and hugging ourselves in this country, since we are such a touchy-feely people. But we've been able to do that. So if we can stop shaking hands, we should be able to also socially distance. But that seems difficult for us to do. You still have people coming up to you to whisper into your ears without wearing a mask, and I cringe. But they do it because they're used to, you can't assume some, trying to share little snippets of information to you without others hearing. And they come that close, so you're forced to push them away gently at the risk of being thought a snob, even though you're not, but you're trying to protect yourselves. In our campaigning, we're going to have to do a lot more house-to-house campaigning, one-on-one campaigning. That exposes us, the politicians, to risk, because you don't know who you're going to talk to and what state they are in, and whether they've been exposed to the virus or not. But we have to do it. We are going around now encouraging people to go out there and register, putting ourselves at some risk. So we need to institutionalize and the mask wearing culture. People need to understand that we can live a fairly normal life if we wear our mask and still congregate with each other and still hang out with each other and do our work and protect us from spreading the virus or getting infected with the virus. And that is what is difficult for people to do, because understandably, we're not used to that. And so people find it difficult breathing, and adjusting to that is taking a while. But we will get there. And so we do need to step up our education, sensitization, and all of that, using all forms of media, and ultimately learn how to live with this virus for the long haul in the event that it doesn't go away, and have a fairly normal kind of life.
Thank you so much, Honorable. I just want to let all our attendees be aware of the fact that there's going to be a time where we'll have questions and answers. So if you have any questions for our panelists, please, I want you to hold it off. You can actually send it through the chat part of Zoom, and we will let your questions out for you. If not, just hold your questions, and we will call you so you can make them available to our panelists. But I'm going to be calling Mr. Kwame BOAKYE-DANQUAH, who is the president of GAG Global Forum. But before he comes in, Dr. Alex Dodo, you want to chime in on one of the questions. So do so, and then Mr. Kwame BOAKYE-DANQUAH will come in with a few questions for our panelists.
Okay, thank you very much. Mine is actually a very, very quick one. And I think Irene was asking a question that I felt we did not answer, but I'm just going to throw it out there. I think she wanted to know that what would be the excess mortality attributable to election-related activities. And I brought that back because the pressure to let Ghanaians congregate has come from the churches, from the mosque, from the bar owners, from everybody. And indeed, the election-related activities is just but a small part of that core. So the question we will need to address historically or one day, what was the contribution of the election-related activities to excess mortality? Given that the pressure to open the country for all sorts of other activities, funerals, churches, religious activities have been ongoing. That is number one. Number two, and quickly, I think we should be looking at South Africa and looking at New Zealand. I'm saying that because New Zealand is completely opened up, free of all COVID restrictions. South Africa had the most draconian of lockdowns, and they are not any better off. And these raises questions which, as policymakers, we need to consider. I mean, I still remain convinced that the stand taken by government was excellent, because we could have killed the economy and yet not been better off. Because South Africa banned everything. Sale of alcohol, sale of cigarettes. Then they eased off, and then they are not any better off. New Zealand had a different approach, and they have had success. And then the last one, Honorable Leslie, I just wanted to add that these two shall pass. Because historically, we have had pandemics. I mean, I think it's so important not to lose sight of the fact that this is being a pandemic of both a virus and a pandemic of news. If we were counting malaria deaths as we are counting COVID deaths, we'd shut down this country. Seriously speaking, H1N1 is known to have killed about 500,000 people. That was in 2011. But we did not have the level of news proliferation as we have now. The Spanish influenza killed about 20% of the world's population at the time. Fast forward to 57, 59, the Asian influenza killed about 4 million people. Fast forward to 68, 69, the Hong Kong flu. So we have had pandemics. They have come and they have gone away. Indeed, if COVID remains as it is in Ghana, it will be one of our mildest diseases, in the sense that others are killing us more on a daily basis than COVID. With the current features of COVID in Ghana, current features, if they remain the same, really they become much, much less of a public health issue than maybe malaria. But because we are now understanding it and it's new, but I am seriously worried that we are counting numbers without context, and that is disrupting everything. I'm done.
Thank you, Dr. Alex Dodo. Mr. Kwame BOAKYE-DANQUAH, you want to chime in on the next set of questions for our panelists? Come on board.
Dr. Ampofo, can I make a few points? Well,
yes, Mr. Yanka, go ahead.
BOAKYE-DANQUAH apparently has a problem with his connection. I've seen his note somewhere. But I'd like to make a few remarks. If he's ready, I'll give him the opportunity. But the point I want to make is that I really get concerned when we do not think regionally or continentally or even globally. We have closed our borders. That's why we are probably talking this way. But the point is that that is not the normal. Our economy runs on regional, continental, and global trends. We have our farmers who have to produce to export. We have travelers to travel to Ghana to raise our tourism revenue. We have a lot of other activities in mining and other areas which have to be activated for the economy to have the necessary foreign reserves for our economy to run. Currently, we know that our GDP is running low. So I hope that all the committees that are meeting and thinking are not just thinking of, oh yeah, Ghana, we are doing well, our numbers are good. It's for how long? That is a that is a point to really think about. So as we are talking, our economy is hurting. Despite the fact that we want to take care of our health, the economy is hurting. It's a reality. And that's why I'm saying that election is only one activity. And therefore, we should think broadly about the others. We shouldn't think narrowly that, oh yeah, our figures are low, so we are all right. We cannot continue to do that for a year. All the other pandemics that have happened, all the figures that we've given, they were able to find vaccines much earlier. As we are speaking, scientists still are not very clear about all the conditions under which COVID can survive. And it is true. So yes, we are making effort. We should thank God for everything, but we should be also considering laterally what is happening. How are we going to integrate into the world system and still survive as a nation? We can have elections, but if we have elections, we get into 2021 and the economy is in a recession as some other economies are at the moment. I don't know about the Ghana economy. Then we are in deep trouble. So what I'm saying is, yes, let's praise ourselves. We are doing well. We cannot continue like that. We need to open our borders. We need to talk to our neighbors. We need for people who travel for survival to travel. We need the informal sector to be active. They carry about 70% of the economy. We need to be thinking about the large number of people who work in the tourism industry who are now laid off, who have nothing doing. See, so and then of course, when it comes to communication, there's something that we missed out. And that is a comprehensive communication strategy. I'm not talking about just health communication. The Ministry of Health Communication Department has no capacity to run an extensive and comprehensive communication for Ghana. I'm talking about a comprehensive communication strategy that goes all the way down to the communities, to the chiefs, to opinion leaders, to be part of that strategy, so that when we are making, the president speaks in Accra, it trickles down through that kind of strategy. You see, we can do the best we can on radio, on television. Don't let us blame somebody in my village or in some constituency who has not heard it. And of course, I won't be surprised if there are people in other parts of Ghana who still are being normal. But I'm saying that in a crisis situation, you need a comprehensive communication strategy that will involve people at the regional level, district level, community level, and everywhere. So that while we are preparing ourselves for the West, let's get everybody along with that kind of attitude. So, and that is what I meant earlier when I said, let's prepare our psyche. See, it's very easy to think that, oh yeah, we are doing well. God loves us. There's no doubt about that. But because we have closed the borders, we have put some restrictions, which cannot continue for another 6 months. Otherwise, the economy will ground to a halt. So let's think broadly and say, what is the worst case scenario going into the future, looking at what is going on in other parts of the world. And let's say that this is where we think we want to go. It's better we plan and prepare our minds. It's all in the mindset. We are talking about behavioral change. You cannot do behavioral change in 3 months. It's not possible. So let's think that way rather than just being, thinking only about Ghana. And I do not doubt that there may be some other people thinking the same way, but this is something that I get concerned about.
Thank you, Honorable Iyanka.
Yeah, Dr. Mpoma, I don't know if Kwame is ready yet, but since I think my name was mentioned a couple of times with different opinions, so if I may have the opportunity to respond, that'll be awesome.
No problem. Go ahead.
Look, we are all here because of love of country. I think we all want Ghana to succeed.
That's right.
And up until this point, regardless of whether you vote for the elephant or you vote for the umbrella, or what other political parties, ideologies you subscribe to, we are all here because we truly love our country and we want our country to really succeed. Now, having said that, now I'm staying away from politics. Okay, I'm just going to speak purely from the medical standpoint. Now, other panelists have alluded to the fact that We haven't seen the same mortality. You know, there were doomsday prophecies about how we're going to see bodies on the streets, and we haven't seen that. Now, the spread towards Africa and the West African region has been slow. It does not mean that we are not going to see that yet. Now, I can give you an example of Florida, where the governor was taking victory laps, high-fiving, okay, you know, calling the news media fake and how they predicted their doom. Look at Florida today. You know, they are really suffering. So it is better to prepare for the worst and hope for the best. Now, we've had conversations with our colleagues back home. I have a family member who works at RAGE. Now, when somebody makes an argument that malaria is killing more people than COVID is, a physician going to work at RAGE Hospital, Kolebu, or Komfanochi Teaching Hospital doesn't have to worry about the fact that he's going to catch malaria on the job and die. We are comparing apples to oranges here. Okay, the efficiency with which this virus transmits. Now, we may not have seen the numbers, but it will be, I would say it would be premature to let our guard down and think. Now, I have communications with our colleagues. Our white paper writing team intentionally involved a very active physician from home because we didn't want to write a white paper being removed from activities on the ground. So we sought the input of people who are on the ground, a very active physician. And the picture he paints is not all rosy like it's being stated here. You know, we may not have seen the numbers, but ladies and gentlemen, it will be very, very premature for us to start taking victory laps and start comparing malaria and infants, infant mortality and, childbirth-related mortality. Okay, recently we had the demise of two young physicians, I believe in the Brown Harbour region and somewhere in the Ashanti region. Two young men. They've lived all their lives. They didn't die from malaria. Now we already have a critical shortage of healthcare physicians. And so if we start letting our guards down, if we don't lose one single body, so the end of this pandemic, and if there is an end, we will all be jubilating. I would rather make that celebration when that virus is completely out of our community than to really start taking victory laps now. I think it is a recipe for disaster if we did that. Now, short of being blasphemous, I don't want to sound like, there is God everywhere, right? Do you think God does not love or didn't love the 140,000 people who have died in the United States? In fact, people who preached for a living have passed. Did God not love them? And so religion is important, and whatever your faith is important. But we shouldn't conflate religion with the facts on the ground. We want Ghana to succeed. And I hope that what I'm saying, that we're going to see people in the emergency rooms who are turned away. When you speak with physicians on the ground in Ghana currently, they tell you how scared they are. Okay, you could go to work one day, catch the infection, probably go home and infect your whole entire family, and we don't know how things are going to pan out. This is a very scary situation. I've seen triaging situation in the military. There has never been anything of this caliber, infectious disease-wise, that has the efficiency and the mortality. Now in Ghana, our numbers are good so far, but I will entreat all, I will really, entreat all that the fact that our numbers are low is not a justification for us to let our guard down. If anything, we should be doubling our efforts, quadrupling our efforts to make sure that we are doing any and everything. Now, this virus is a contact-related transmission, right? So if people are bunched up, now we know. I made a prediction before the CDC even put out their recommendation for everybody to wear masks. It just made sense. If you have a virus which transmits by bioaerosols, at that time, the research that was available was that it could travel up to 27 feet. When the CDC was talking about, oh, masks may not be necessary, it only made sense. Now, you don't have to be a rocket scientist or a brain surgeon to figure out that if you get exposed to these aerosols, you are going to get it. How people respond to this virus is a function of their internal immunity. Now, there's been this saying that, oh, because we come from, quote unquote, to use President Trump's analogy, shithole countries, we've been exposed to all of these infectious pathogens, and hence our immunity may have been ramped up, and that is probably why. Now, until the science proves that to me, I would rather not take a trial of that. I would rather it does not happen than to make some sort of an educated guess that, oh, my immunity is going to save me, so I'm going to be careless. We should not do that. If it is not your family member who just died, you see, it's your young who, all right? We may have had 144, but go talk to the young man or woman who just lost their dad, who happens to be the breadwinner, okay? Go talk to a young kid whose future going to college is probably jeopardized because they lost the one person in that family. So we may make a calculation that a 0.5% case fatality rate is acceptable. Of course, there is always collateral damage that in positions of leadership you have to make. We've lost some prominent people. Sir John recently. Those are the prominent names that we come to know about. But who is advocating for that man or that woman who walks the streets every single day trying to provide for their families? Okay, we should not lose sight of that when we are put in a position of leadership. Every single person counts. And so I would really, really caution against premature celebration. Once again, this is not a political statement by any stretch of anybody's imagination, but from the perspective of a provider. Because when I walk in there every single day and I interact with people, it is my hope that I am not the conveyor of that disease, to that patient. And so, yes, our numbers are good and God loves all of us. But please and please again, let us not compare the role of God to science. The evidence is clear. The evidence is undeniable. If we do not put in measures which sort of stop the transmission, we've been slow in getting on board with respect to the transmission. People have, I think, made the pronouncement here today that, oh, we were worried about the registration exercise, leading to uptake of numbers. If we are already 2 weeks behind testing, it goes to tell you that we probably haven't seen the worst yet, right? Because the registration exercise have been ongoing for the past 2 weeks. We are already behind 2 to 4 weeks. So we may come back 4 weeks from now and see a skyrocketing incidence rate, because of the activities that are going on now and that we expect to go on going forward because of the impending elections. And like I said, if we don't lose one single body going forward, it will be excellent. We will all go to that end and celebrate and jubilate. But we are in the middle of the most life-altering, defining infection of our time, in our lifetimes. And so please let us use all of the resources, all of our positions, to really make sure that the most vulnerable are protected. And we shouldn't make light of the fact that, oh, our numbers are okay. Even at 0.001% is still not acceptable, but we know we don't have the luxury of doing that. And so I will really beg those in a position to sort of effect change to really not rest on our laurels at this moment, because that would be a catastrophic mistake. My 2 cents.
Yeah, maybe my short comment on that. Doc, I want to assure you that we are not sleeping. We haven't given up. We are not celebrating. We are taking the disease head on. And all what we are saying is that's exactly what we are doing. We are 2 weeks behind testing because of world problems, that everybody is going to the same place to buy reagents and kits. And that's the reason why that happened. So please, we are optimistic, but not lost our guide. We'll continue doing what we are doing. His Excellency, the President, is actually making us, asking the most difficult questions. We want to put this disease behind us. We want to live near normal life, new normals. So don't let us throw our hand in this thing that everything is lost. I don't believe so. I think we are doing exactly. It's not only God. God is helping us, but we've put in very pragmatic things in place to make sure that we tackle disease head on. And that's exactly what we are doing. So please, yeah, people will tell you all sorts of things. Some people will tell you from the angle that they are talking from. We are taking care of all healthcare professionals. We're giving them the necessary PPEs. Yes, there can be problems with the distribution. We've strengthened it. We set up a committee, including the healthcare professionals themselves. And we are making sure that they get the necessary things to work off, the necessary protection. We are also making sure that they also abide and go by the infection prevention and control. I'm sure you are very much aware that working in a healthcare environment is a very risky, the high risk people. But there are things that you do, either COVID or no COVID, you have to follow the infection prevention and control. That's exactly what the unions are doing, Ghana Medical Association and others are doing. So we will continue praying to God also to continue to guide us and make sure that whatever figures we are getting here stays the same. And I'm very sure that this is what is going to happen. Secondly, to also add something to what Professor Yanka said, yes, the easing is being done progressively, and we are going step by step and make sure that we do it phase one. We are thinking of, we also are in a hurry. The president is in a hurry to also make sure that our borders are open for normal economic activity to go on. We are also, the technical team has been meeting all the sectors, and we are all very much concerned about the hospitality sector, because a lot of people are losing their jobs. Anytime I pass by any hotel, the huge ones, the air conditions are on, there's nobody there. It's heartbreaking. And we are making sure that, how do you do it? The only way you can let people come in is when you open the borders, especially move the sea, the land and the air borders. So we are doing this in phases, and we are doing it cautiously to make sure that we don't also bring in a lot of problems into the country. We are all praying there and making sure that the scientists will work together to have a vaccine as quickly as possible. We are going to live with this disease, but we have to live at least near to normal life. And this, we can do it not only by Ghanaians or by Ghana alone. I know that there was recently a virtual meeting of all the ECOWAS sub-region to find ways of easing up and opening the borders. And this, we are working together with everybody. But I can still assure Dr. Kwarteng that we are aware of everything. We are following the figures, we are following the science, we are following the dynamics of the disease, and all what we are trying to do to make sure that we don't have an overwhelming issue on our hands and we solve the problem. Very soon, we have put up another infectious disease center by the private sector, I think it will be commissioned on the 24th, where we have about 100 beds plus for 16-bed ICUs. It's just an infectious disease center. Another one will be in the middle belt, another one will be in the south, northern belt. These are all things that we are trying to do with. As a country, I've also realized that even though we have healthcare professionals working in the hospital, there are some aspects or some specialties we have to try as much as possible going forward, also to train more people. And that is intensive care, and then the care of the very sick. That is critical care. We have to get enough physician intensivists, and then critical care nurses trained, and the technicians need to man the machines. So these have opened our eyes, and we are going straight and then tackling the problem head on. So please, if anybody compares the disease malaria to this, all this just comparative analysis, we make sure that we should also not lose sight that there are other diseases that we have to tackle as we move on, not to concentrate alone on COVID. But we all know this is a novel virus. Nobody knows how it's going to mutate, and we are all following slowly and cautiously, and sometimes with some optimisms, and then making sure that we don't lose our guide, and we are very optimistic, but of caution, and that's exactly what we are doing. So don't get anybody wrong. We are also not getting you wrong. We know where we are coming from. We know also where we are doing. But all these things were put in place. We have a strict strategic direction that we are using. So we are following our strategic directives, which are 6-point strategic objective: contain, stop importation, care of the sick, make sure that the economy runs very well, and then empowering other people to also become, so that Ghana becomes Ghana beyond aid, so that it becomes self-sufficient. These are the 6 major strategic issues that His Excellency the President put forward, and that this is exactly how we are going. We haven't lost focus, and we are not going to lose focus. And everybody, today I'm very happy that I've listened to Professor Yanka and all of you. It will help us to polish whatever our strategic direction is and make sure that we do the right thing. This fight is not one person's fight. As the president says every time, it's Ghana fight. It's the whole country, plus our people in the diaspora. So we continue to also make sure that we get everything from your side to better this. Thank you.
All right, so we are going to take a submission from Honorable OWUSU, and then after that we're going to be opening up the platform for questions. Basically, we have Miss Irene Hasham who would ask a question back. Honorable OWUSU, could you please go ahead and summarize on this?
Thank you. Just a brief comment that nobody's belittling the impact of this disease on our economy, our social life, and every aspect of our life in Ghana as in the rest of the world. We've taken a hit, a huge hit, and we're trying to see how we can keep our heads above water. Neither is anybody also belittling the fatalities that we've had already. Every life lost is important. However, we also do need to put things in the right perspective. Ghana took some decisions, His Excellency the President took some decisions very early on, which have helped us contain the spread, and which others are now seeking to do. And so let's not knock ourselves. We've done some good things that have helped us. It doesn't mean we're going to premature celebration and think that the battle is won. It is nowhere near being won. Every day that we get new infections is a source of worry to everyone, and we haven't stopped working around the clock with our limited resources to resolve the issues as they arise. But this is a new disease. We're all learning each day something new. And the latest information that I heard was about this hairdresser who was asymptomatic but wore her mask and went to work and did not infect about 130 people that she worked on. So the mask wearing is important, and that is what we need to drum into people's heads. Yes, we will make some mistakes along the way. We're human, then we will bear the brunt of that. when I look at how the tourism sector has been impacted by this disease, just coming on the heels of a very successful year of return that we had last year, and the launch of the Beyond the Return and the plans that we had in this sector and other sectors, my heart bleeds. The economy is going to take a hit, has taken a hit. The impact is going to be felt over the next 2-3 years. It's going to take us a while to come out of it. No one is underestimating the impact that this disease has had on us, will have, and how we need, what we need to do to get out of it. So let's not think that by saying that there are other diseases that are killing more people, it means we're belittling the virus. I don't want anybody to leave this webinar with that impression in their minds. I've read some of the comments, and I'm not very happy that that is the impression that seems to be created. But we do need to be realistic. That and I think that we focus so much on the negatives that we don't seem to realize that we have done some good things that have stood us in good stead. And there is nothing wrong with acknowledging the strides that we have made, focusing on the challenges that remain, and urging each and every one of us to still continue to put in place the measures that will help protect all of us. Simple, and there is personal responsibility as well. The state may put in all the protocols. If the individuals do not abide by them, we will still continue to get spikes. Life cannot come to a halt. Let's not forget that. Our markets were never closed because we don't have the luxury of going to malls and supermarkets. We work, we trade from the Makoles and Agbogbloshis, and so those markets were never closed. Largely after the lockdown and the easing, economic activity is slowly coming back to normal. But we shouldn't also act as if with the progressive easing of restrictions, it means we're completely out of the woods and we can get back to life as normal. That perception is running rife in certain quarters. So it's incumbent on all of us to step up our public education and urge people to heed the simple protocols that have been put in place. I agree with the sentiments that have been expressed that our health system cannot take the onslaught of cases that other parts of the world are seeing. So we need to do everything possible to reduce the spread of this virus as much as possible. And since we've now been informed that it is spread through the air, I think the easiest way to protect ourselves is to keep hammering on the fact that we need to wear our masks if we're leaving our homes and get some enforcement of these directives going. But no one is downplaying the impact of this disease. No one is saying that we're celebrating prematurely, that we've done a great job so we can all put our feet up and go to sleep. No one is belittling the impact that it has had on every facet of our lives. We're all very, very keenly aware of it and realize that it's still getting out of the woods is still some way ahead. We're not out of the woods yet, but we've largely been spared. And like some previous speakers said, we do need to research into why Africa has largely been spared and see how, if we can bottle that and sell it. It will probably be a huge money earner for all of us. And that was said in jest. Thank you.
Thank you, Honorable. Just a point of acknowledgement for everybody. Remember that this is Ghana Advocacy Group. This is our global forum, and this is our third line of having a forums and discussions on sensitive and issues that really affect Ghanaians globally, wherever you are Ghanaian, wherever you are. So we just want to appreciate all our panelists for coming and for making your known views and ideas, and also for appreciating where everybody is coming here with their minds and discussion. The topic for discussion today is the elections are taking place in a democratic atmosphere as the world wrestles with the novel coronavirus pandemic What are some of the challenges for Ghana? That is the topic we are discussing today. And I believe that each and every one of us, before we leave here today, I believe you've gotten something concrete to take home. And we are so appreciative of our ministers and our government appointees who have dedicated their time to come and to discuss and to share ideas with us. We also appreciate our professionals, our health professionals, obviously, and Professor Yanka also for coming in to share his thoughts with us. This is very, very fundamental, and this is what group discussion is all about. I'm going to call on Ms. Irene Hersham, who is also my co-moderator, to chime in with the next question.
Thank you very much, Dr. Ampoma. My next question, and I am conscious of our time here, so I'm going to be very quick on this one, is to the scientists on the platform here. And it's in relation to testing. Ghana has been hailed, and quite rightly so, for our initiatives in testing, how we have been rapid and have ramped up the testing and managed to trace contacts. However, it is also known that the figures we have are confirmed cases after testing. So the question to the scientists is, as has been done elsewhere in the world, where the figures are giving, these are the confirmed cases, but by certain calculations, and I don't know how the scientists do this, they can give us, these are the confirmed cases, but when we believe that the actual cases will be, for example, 5 times higher. Do we do that in Ghana? And can we say to the populace that by saying we have so far 26,000 confirmed cases, in reality, taking into account asymptomatic patients, that would actually mean X figure? And if so, what is that figure? And that's to the scientists on the platform. I don't know who would like to take that.
I'll have a jab at it first, and maybe Dr. Asare. We have been doing what we call the positivity rate, as in trying to find out that within the population, if you take the whole of Ghana, what do we estimate the infection to be? And currently it's hovering around 7%. I think, to put it in context, I think the UK is also looking at between, the last I checked it was 6%, but it moved to 8%. And I know James Ajay may also add, Prof. Ajay may also add to it. But the figures we are looking at is about 7% infectivity rate, as in 7% of the population are infected. That is the calculation based on the same method used by others. So this is the direct question. It is a direct answer to your question. But I think I just want to throw in one more thing the president said, that as a country, most of our decisions are going to be driven by our data, by our scientists, and by our processes. And so even before, I think most places in the US and others went on to mask, we have started with masks. Interestingly, when the president gave a directive for masks and other protective gear, he called the Standards Authority, our Food and Drugs Authority, our textiles manufacturers, and our garment manufacturers, even to decide whether we should use cotton or gray baft. We came to our own labs, tested the permeability, came up with standards showing that we needed a 3-ply so that we could calculate how many particles we go through. So really what we have been doing is that we are trying to ensure that the decisions taken for the healthcare of our people are driven by the science generated by Ghanaians, obviously when working with others across the world. But the figure we have now is 7.2% of the population assumed to be infected. Over.
All right, thank you so much, Dr. Alex Dodo. We have one of our attendees who has a question for Dr. NSIAH-ASARE, and this is coming from Mr. Eric Agboli. He says, you did mention about that the government is supporting scientists for vaccine research. Okay, for vaccine research. Come back over here. Yes, he would like to know if we have competent scientists or institutes in Ghana for vaccine candidate research, or is there a plan for establishing an institute for such research? Dr. Asare or Dr. Alex Dodo can pick it up.
Yeah, thank you very much. There is a Noguchi Memorial Institute. And there's also KCCR. They are well-renowned. Noguchi Memorial Institute is a well-renowned research center. In fact, the head of the virology is I think, vice chair of the African vaccine initiative, manufacturing initiative. So Africans are all working together. It plays a very important role. So there's a research institute. There are research institutes in the country who are working this.
And Doc, let me add that we have a lot of scientists. I mean, myself, I have from 2006 till about 2012 chaired the Global Vaccine Safety Initiative, involving the US, involving the EU. Professor William Ampofo, who is the lead virologist at Noguchi, he isolated the HIV virus here, but he's been working with the US government for years on pandemic influenza monitoring. You have mentioned KCCR, we haven't mentioned the University of Health and Allied Sciences. And it just out to our colleagues who may not know, the first malaria vaccine was actually the first entry into humans for the malaria vaccine was in Ghana at Kintampo. And we led the search for it, and now it's been licensed by the European Union, and Ghana, Malawi, and Kenya are actually conducting what we call the large implementation studies for us to decide whether to add that. So the simple answer is yes, we have a lot of scientists, immunologists, basic scientists, microbiologists, and the like. And His Excellency the President has actually tasked Professor Ampofo to establish the Ghana Vaccine Manufacturing Initiative as part of our response to COVID, so that in years to come, obviously it takes time, we would be able to rely on our own resources.
Even to add, we also have 3 research institutes in the 3 ecological zones. We have one at Navrongo for the northern zone. We have Akintampo, where the malaria vaccine clinical trials took place. And then we have another one at Dodua. And the scientists in the University of Ghana, those in the University of Cape Coast, UHAS, and KNUST are all working together to come out with a very good response to COVID-19. And we are also working together with Ghana Academy of Arts and Sciences. They are also helping us. We have about 5 groups who are doing modeling. We want to have our Ghana model so that we don't use what is coming from outside. Thank you.
So can I also add?
Yes, go ahead.
Okay, so I think this question is assuming that the best science is done in the developed world, which probably is true. I want to say that a large majority of the scientists trained in the developed world. I don't know what percentage it would be, but probably about 70–80%. My department, for instance, all the faculty members either trained in the US, in the UK, in the Scandinavia, or somewhere else. So Ghanaian scientists are competent, just to add to that.
Okay. And I think we have Ms. OWUSU-EKUFUL. What are your thoughts on the summations from Dr. Alex Dodu and Dr. NSIAH-ASARE?
Well, I think, when we look at the COVID situation, and it's really unfortunate that the impression was given that we are tribalizing it. We are not. When COVID hit Ghana first, we all panicked. To tell you the truth, the lockdown of the country was when we've had, I think, 2 or 3 cases, because we were scared that if we don't take action. Now, what is our response? Thankfully, with what we can say publicly, some of us are all serving, several Ghanaians are serving the presidential team in anonymous roles, purely because we've all signed up not to see what we are doing, but to leave the big house to only do the front end. But what has happened is that we have realized acutely the need for social scientists to drive the agenda. Because as we've all discussed already, there's so much in terms of our behaviors that we are yet to understand. So in simple terms, the government has taken this seriously. Across the political divide, we've been able to gather ourselves to offer solutions. What we would expect from GAG is that please, please, please hold us to account, but please feel free also to bring your suggestions, because at the end of the day, we have to win together. Some of us have raised questions, and I will continue forever to raise the malaria COVID question purely because they are coexisting. And I'm actually coming up with a piece on how do you treat malaria in the age of COVID, because we are having cases not being treated because of the fear of COVID. And by the time the results come, people are passed on. So it's about the pragmatism of the situation, that you have coexisting conditions. You need to cope at the same time resources. But we need, especially our colleagues out of Ghana, are those who see whether the path we are treading is a straight path or not. For as long as they don't want us to tread the American or the British path, but the best path for this country. And we'll really thank you for that, because really we are a poorly resourced country. Everybody knows that. And we can never develop without the inputs of our colleagues, especially those in the rich north and those who are exposed to publications and research that we would probably not have in Ghana. So really, it's a Ghana together or Ghana winning together game, and we are hoping that together we can win.
Thank you, Alex.
To add something quickly to what Prof said, we should also be mindful of the stigmatization in Ghana. So when we are doing anything at all, especially our colleagues from the diaspora, we know that we've seen a lot of people dying, the hospitals being choked and all. But please help us also, so that we problem now in this country where people it's difficult even to go for their referrals, go for problem started. Our own colleagues from outside, all over the place. So anybody who is tested even positive and is asymptomatic, it was becoming very difficult to move them even from their localities to isolation centers. That is something that we are slowly through social behavioral and communication change, we are trying to solve that problem. Intensive care units are now the advocates. They are out saying that the disease is real, but it doesn't mean that if you have COVID-19, that is the end, and then all your family should be labeled COVID-19 patients. So this is something that we are also managing as possible. We have to all work on this thing together and make sure that the fear alone doesn't prevent people from accessing health that they need and kill people. Thank you.
Thank you so much, Dr. NSIAH-ASARE. But we've spent a lot of time tonight. I hope every question could be asked, because we have the right people on this panel to do so. But I believe that time is not on our side. So I just want to take this opportunity to, first of all, on behalf of Ghana Advocacy Group, Global Forum, thank our distinguished panelists for especially availing your time. We know how precious your time is and your resources for coming to spend time with us to engage us about current happenings in Ghana, especially looking forward to the election that is coming up here. I believe that we also have our panelists who are from the scientific point of view, who've made also their views were clear to the panelists and to everybody who is here. Please, this is our third lines of forums we've organized. The fourth forum will be coming very soon. And it is our belief that you will partner with us, same as the Beyond the Return has partnered with us. So God can continue to explore and to advocate on behalf of all Ghanaians. As a result of this, I just want to say thank you all so much, and have a blessed and a good evening. Thank you all.